Good morning.
Good morning.
Morning.
Good morning.
The way this meeting snuck up on me today,
Yeah, you and me both. Me coming back from Florida last week, so I'm like, wait a minute.
Dr. Silver, what's on our agenda? I don't think we had a moment to meet, and if we did, I certainly forgot about it.
I know I just asked her if you guys did your pre-meeting, but I think it was just missed. So let me screen share. Give me 1 second as I find it. Good morning, Tyrone. Or Mr. Walker, excuse me, Board Member Walker.
Either's fine. Morning.
Good morning, Mr. Walker.
Good morning. Is that Bethany? Dr. Silver? Yes.
Yes, good morning.
I'm just checking with a few board members. We'll let you know what they say. Can you all see the agenda on the screen? Okay.
Yes. Give me a moment to get in transit.
No problem. And then in the meantime, I'll let you know if any board members respond.
Hmm.
All right. So, any updates on other board members?
You're muted.
Pastor AJ, what was the question, Pastor AJ?
I'm sorry, I was.
Are there any other updates on board members? My bad.
No, thank you.
Oh,
Sorry.
okay.
And I was muted, have a whole speech ready. No, not yet. I did text Ms. Escorbano and Ms. Daristo Ledger, who have not responded yet. I do believe actually with the new committees, I think Ms. Escorbano is rotating off of policy, but I need to confirm that. But either way, I did text, so hopefully they'll be able to join.
Okay, are we comfortable to kind of get rolling? Okay. All right. Well, good morning to everyone. It is a Monday morning. I have not seen the sun in a long time. Christina looked like she's seen enough sun for everyone. But that's just what rich people do, you know. They take vacations and they go chase the sun. So with that being said, welcome to our May 1st policy meeting. April showers hopefully brings May sun and May flowers. Let's pray that's the case. I don't think we have a lot on our agenda today, but I certainly want to hand it off to Dr. Silver to just go through our agenda with us today and what's on our agenda today.
Thank you so much, Pastor AJ, and good morning, everyone. This morning, we have 4 policies for a second reading, or 4 items for a second reading. Christina, could you put the agenda up again? I'm sorry. I just wanted to mention what those policies were for a second reading. So we have a student attire policy, a school governance council policy. We have recodification on 4 policies, and we have a legislative and advocacy committee policy also up for a second reading. Then our first reading will be for health services, followed by a discussion about Juneteenth, any updates there, as well as bylaw 9020 around public statement. So with that overview said, I'm going to start with student attire, and I will start by sharing my screen. And this is a second reading of student attire, and this policy was reviewed by parents. And we did have some minor revisions, some edits around, these edits here that you're seeing in the left margin are around formatting. We did update this to change from masks to full facial coverings, and this is a change that went for a first reading to our board. We have not received any edits or revisions. We did add the statement here, or health needs, with regard to facial coverings. And this is, of course, stemming from our experience with the pandemic and the need to wear masks. And so we don't want to make those against school rules. We updated our language to refer to students in a way that does not call out gender, in alignment with our transgender policy that we adopted in the fall, that our board did quite a bit of work on and our community responded to very positively. We revised the word picnic to the word celebration. And these are all changes that everyone has seen. Our parents also had lifted the request to use for schools to select quality logo patches that will withstand many washings so that students, they don't fade or fall off. And that concludes the revisions to this policy, an overview of that. So.
Okay. All right. Yeah, no problem. Thank you so much for that overview. I don't think this is something that we have to stay at too long, unless Tyrone, you have anything that, Board Member Walker, unless you have anything you see that's alarming and out of the norm for, you know, first couple times we looked at it.
No, I'm peeking at it again, Reverend Johnson. I would just asked Dr. Silva where I was looking for the policy. Where is the kind of the enforcement piece? Is there the policy pretty clear on what to wear, what not to wear, and whose responsibility is there the language that, you know, students will be sent home or students will have to make some modifications if they're out of compliance? I didn't see that so clearly spelled out. Did I miss that in this?
No, thank you so much for that question, Mr. Walker. The compliance piece and the operationalization of the policy needs to take place at the school level, which is a management function. And so the administrative regulations would cover that. To your question, if we did visit with parents, and parents really value that a principal at the school, they'll maintain a store of additional items that align with uniforms, so that if a student shows up and doesn't have the appropriate attire, they can borrow something from the oh gosh, I can't think of what it's called, but where they're holding additional uniforms for that purpose.
Okay, thank you. So then the one action that Dr. Silva is, could you share with me kind of that management or operational procedure outside of this discussion? Because I think that'd be something that I'd want to see, just to understand how it's operationalized at the school level. Because that's what I was kind of looking for. The policy as itself, to your point, Pastor AJ, I think it's fine as written, just as a policy.
Absolutely, Mr. Walker. Thank you so much for that question. And I will locate those administrative regulations and provide a copy to, I don't know if you would like it for the entire policy committee or if it would go to the full board. Either
Sure.
way.
Yeah, at least to the policy committee. And certainly, I mean, Christina, you're free to add as an attachment that's shared to the full board if it's their interest to look at that. Okay, thank you.
Yep. All right. Thank you, Mr. Walker. Yeah, I think we are ready to send it, move it forward. It checks all the boxes in my mind of engagement in, decent policy. So yeah, let's move forward to our next agenda item.
Okay, thank you very much. We'll move this forward for a second reading at our next Board of Education meeting, and we'll move on to the policy on school governance councils. Just locating that. Here we are. So I will share my screen. Okay. Now, this policy is also up for a second reading with our Board of Education. The School Governance Council policy. These school governance councils are in place, and this is a strong policy. There was a legislative change, and it has to do with the voting, terms of voting. The change was that voting members shall have a 2-year term, and no one member can serve for more than 4 terms on a council. That was revised from 2 terms to 4 terms in the legislature. So that is the change. This policy also was socialized with a group of parents in December, and we received feedback from them. It was very, very helpful feedback. And a good opportunity to revisit the policy and understand the how the policy works and how it supports our school governance councils. The legal references were updated also. And the policy number was updated in November And that is an overview of this policy. And again, the change really is what is legally mandated, a 4-year term. I'm sorry, can serve no more than 4 terms on a council. So that is the change. Back to you, Pastor AJ.
Yeah, thank you for that. Again, I don't think this is one of those policies that we need to stay more than but a few moments on. I think it's laid out pretty clear on what we, what the expectations are, and it makes sense. I mean, no parent should serve any more than 4 years on the SGT. So, Board Member Walker, any
No, thank you, Pastor AJ. I have just a couple of specific questions. The 4 terms I get. So, Dr. Silva, to be clear, is a term considered 1 year? Is that how they're determining a term? Or is it 2 years? I was kind of a little confused with that 4-2 thing.
Yes, thank you for that question. Voting members shall have a 2-year term. So it is a 2-year term, and they can serve no more than 4 terms on a council. So
Okay.
could be
So
up
that
to
was
8 years.
8 total years. That's what I was, because to me in the policy, it didn't seem like it clearly spelled that out, but I just want to be clear, because I saw in the policy that you did a whole lot of erasing all that two-year. So I see 4 terms on a council, and then it says non-voting members can serve a 1-year term. Okay, I see it. Yep, I see it. It's clearly spelled out. Okay, yeah, I'm totally good with it. I just want to make sure that was absolutely in writing. Okay, I'm good.
Okay, thank you, Mr. Walker.
All right, awesome. Yeah, Dr. Silver, like I said, I don't think there's much we need to do on this one. So I am comfortable to move forward. Lori, Attorney Mazurek, I want to bring you into this space. Is there anything according to this policy as it pertains to parents that is alarming to you?
Nope. I think you got the feedback. It's in line with the update to the legislation. So I think it looks good, like it's ready to move forward.
All right, I appreciate that, Attorney Mazurek. It was good to see you this morning.
Same here. Good to see you too.
All right, no doubt. All right, Dr. Silver, let's move on.
Okay, so we will bring the School Governance Council policy back to our board for a second reading and adoption at our next board meeting. Then we have a series of items for recodification. And on those items, the only changes are the numbers of the policies. So that would be our district accreditation policy, our report cards, grading, and smoking and tobacco use. So I'll start with the district accreditation policy just to demonstrate that that is indeed the only change. And
Dr. Silva, are you sharing anything with us?
not yet. I'm going to.
Oh, okay.
Going to pull up those policies.
Okay.
In 1 second, I thought that I had opened everything.
I'm actually willing to trust you almost, but you're free to pull them up. I'm trusting that only the numbers changed.
It's always, yeah, I guess high accountability, right? So let's see, district accreditation is.
They're listed in the agenda item if you'd like me to screen share that or go through the policy.
Oh, I have it here.
Okay.
Let me just share my. Here we go. Okay. I think this is the sequence that I wanted to include. So our first one is district accreditation, and you can see the 6200 is removed and the 1531 replaces that. And that is the only change on this policy. And we would, of course, add when it was recodified or updated. So that is district accreditation. Christina, okay, the next policy is report cards that had recodification. And that is, no, that's not that.
I'm glad I'm not alone with the like 1,000 things open, but but
Thank you for your patience. So this number has been revised to 6146.12 from 6142. And that is the only change on the report cards policy. Then the next policy is grading, where again, all we did was change the number and added a 0.1. And when we did administrative regulations, we did reference the graduation policy number, which has also changed. So 6146. So that is.
are you going to show the accreditation one too? Or did we see that one already?
We did see the accreditation one.
Yeah, we saw
Oh,
that
the
first.
smoking and tobacco was the last one.
Yes,
Sorry.
sir. Smoking and tobacco use. And so that is the change here. 4118.1232 and 4218.232. There we go. So those are the changes on this policy. And that is an overview of the recodifications for second reading brought to go to our board for our next policy meeting, if our board so wishes.
Awesome. Thank you so much. Thank you so much. All right. Well, let's, first let me recognize the chair that is here, Chairman Philip Brigger. But outside of what I've heard, I think we're ready to move forward. I mean, we've gone through these policy changes or these number changes, previously, so this is not new to us. And let's march on, Dr. Silver.
Thank you so much, Reverend AJ. And our next policy is our legislative program policy. It would be bylaw 9360. And I'm going to switch what I'm sharing. I believe it's this one. Okay, and we did not have a school board legislative program, so this model policy, of course, this would be removed. There were two possibilities, and our choice, the choice expressed by our board was to go with the second option, school board legislative program. So this is the policy, and we would add adoption information here, but this is ready for a second reading. And back to you, Reverend AJ.
Okay. All right. So this is going into a second reading. Any comments on this particular bylaw right here?
Chair Pastor Johns, I have one question, just a clarifying question.
Yes, sir.
This is relating to CABE and not the legislative and advocacy committee that I've asked this team to take a look at, correct?
I believe so.
No.
The answer to that question is this is not that.
Okay.
Why did I think it was? Hold on. I thought this
I
was.
have a question then, because the way that I read it, this policy would breathe the life into what Phil had recommended. It to me would kind of formalize it and seemed like it would put it, it would codify what Phil was asking about or
Yeah.
recommending we do.
This is just a CABE sample, because CABE has sample policies, but this was what that would be. And I think I talked with Dr. Silver. I don't know why it says program, but it's going to be a committee.
Right. Dr. Silver, can you give some insight to it? I mean, I do agree with what you're saying, Board Member Walker.
Yeah. Silva's answer. I guess the other question I would ask, if I follow Pastor AJ's question, is as I'm reading these, are these two alternatives and we pick one or the other, or that's the other thing I would say, or do they go together, or would you pick one piece of legislation or the other as your policy?
Mr. Walker, I believe that question is for me.
Yes, I'm sorry, Dr. Silva. Yes, yeah.
All right. So originally, when we received the CABE model, there were two options, and
Oh,
so we selected the second option as the better language for our Board of Education for our policy manual. Our board members weighed in and selected this language. So that is why the policy appears as it does. And as you see here, the text, another version to consider would be this second version. And this was the version that board members preferred, identified as the preferred language.
okay. Yeah, my apologies. Somehow the version of the document that I have doesn't have the markup in it. So apologies. It's clear now that I see your version that has the markups in it. That somehow I got a version of that didn't have language marked out. So, okay. It's clear. Thank you.
Thank you.
Back to the original question, and I think, I'm not sure. Is this document associated with our intentions for the legislative committee that we put together?
It was my understanding that yes, it was. While we go ahead.
Yeah, what I was gonna say, I think the confusion is the word program,
Mhm. Yes.
right?
Yeah.
So, and I think Dr. Silva has made that correction. So, school board
Yeah, no,
legislative
okay.
committee, yeah.
Yeah.
And
Okay.
again,
Awesome.
if we need to pause and add other wording, we do have the task force in place. So, and I know Chairman Rigger, you said, as you know, even if it took a few months, you wanted to get it right. So let us know, board members, now if you feel other than program to committee is anything else.
What my only suggestion, and I know this is the second reading, would be to maybe socialize this with board members again. I mean, it's May, right? So I think we could wait another month if need be. Again, I have no problem delaying this, as long as, again, we just have to make sure it's right. And that folks understand exactly where we're going.
Yeah, this is Board Member Walker. I would agree with Phil that taking an extra month would be perfectly fine. My question though, or comment here is, let's define what the board's going to do. There's no mention of other players involved, whether community folks, other stakeholders could be part of this legislative committee or process, whatnot. I don't know if it needs to be in the bylaws or if that would be part of, some further, directive around this. So
So-
that
so-
was not clear.
I just want to provide some clarification, as this is a committee of the board. The composition of this committee would be board members. So stakeholders, parents, teachers, and so forth could certainly provide input and comment, but in terms of members of this committee, it's for board members.
Well, the reason I'm saying that, Phil, is because in our bylaws, we're able to have advisory committees. So where we can limit it like that, our bylaws allow us to have more expanse around that. That in all these committees, you can have non-voting people, you can have others as part of the process. I totally confer with you that basically the final vote, people who make the decision will be board members. But there's not a limitation that says only board members can somehow be part or have voice or somehow be part of. We can make it that way.
So I think you might be misinterpreting what I'm saying. So I'm not saying that other people cannot be a part of those meetings. I'm saying the members of this committee are board members.
Right.
Like hard stop, right? Like members of the committee are board members. How the chair gets input from different stakeholders is, and I think this is consistent across all committees, is upon
Yeah.
that chair. So again, I would look towards, I guess, Lori or Dr. Silver to say, I'm not sure exactly what the bylaw says about advisory committees, but I do know that if there's if the chair wants to have public comments and so forth, we could do that. But
Yeah.
members of this committee are going to be board members.
Yeah, but I'm pressing that further. Yes, you can limit it like that, but you can be expansive. What I'm saying, we just voted for a student governance committee where that governance committee had non-voting members. And so what I'm saying is it's within the purview of the actual board to say we can form a committee and have non-voting people that can be part of the committee, right? Like, I agree with what you're saying. The board members are the only voting people, but they're non-voting members of committees, and that doesn't offend, right, the integrity of a committee.
Yeah, I just fundamentally just disagree with you, I guess. Like a committee of the board is for board members. I'm not playing around with words here. Like, it's a Board of Education committee, so therefore the members of the committee are board members.
We won't resolve that here. All that I'm simply saying is that.
So I do think we need to resolve it here because it's a policy question.
Well,
No.
So I'm saying, my policy question, there's nothing that prevents a committee from having non-voting members. That's all that I'm saying.
Okay, and what I'm trying to explain, Tyrone, what I'm trying to explain to you is very clear. A member of a committee is a board member. Hard stop. Right? Now, if you want someone else that's a non-committee member to participate in the board, then yes. But you keep saying member, and I'm saying that's not true. If we want other people to be a part of the committee to provide input,
yes,
then yes, but they're not members per se.
Right. Agree.
But you keep saying non-voting member. That's not true.
Okay. So I guess I'm saying non-voting participation. Because
I'm perfect. Yes. Okay.
Okay. Because to me, I agree where I'm trying to align, Phil, on your point is voting, non-voting. Now, if you want to have member versus participant, that's fine. My dividing line was voting versus non-voting. If your dividing line is member versus a non-member, I'm okay with that too. Okay.
If you're a member of the committee, you're able to vote. So that's so for me, that's the distinction.
Well,
if you're a member of the committee, then you can vote. So when you're saying non-voting, it doesn't make sense to me.
Well, I agreed. All I was simply saying through the previous example is when you look at the SGC, for instance, you do have constructions in which the dividing line is voting versus non-voting. And I hear what you're saying, and I agree with you. We can make the dividing line because all you're getting at is the distinction you're making between member and non-member is, in essence, somebody gets to vote and somebody else does not get to vote. And with that, we're absolutely aligned that only the quote unquote members of the committee can vote. Yes.
All right.
The idea of the other people would be people who provide input and provide voice, but don't necessarily provide a final vote. And I'm okay with your nomenclature. If you rather have to be a participant versus being a non-member, I'm fine with that.
All right. I got it. I think we're landing in the same spot on this. I appreciate the dialogue, though. The dialogue has brought a lot forward. Dr. Silver, did you have, so you came off mute as they were talking. Was there something that you needed to say or wanted to add to the conversation?
Thank you, Pastor AJ. I do want to clarify that the School Governance Council is a council, and that this policy, this school board legislative committee falls under the bylaws of the Board of Education and would be comprised of members of the Board of Education. So just to that clarifying point. And I see Ms. Brody also has her hand up. Thank you.
Yes. Good morning, Mrs. Brody. Not sure if you know where we are in the conversation, but we are on the agenda item of the legislative policy pertaining to our bylaws. Go ahead, the floor is yours, Ms. Brody.
Good morning. So my question, because I came in when it was saying members, non-members, how does that, and I guess Dr. Silva may have touched on it in regards to, was the discussion in regards to individuals who are not board members? And if it was referring to members who are board members, I'm asking for a little clarification.
Yeah, because I'm a gracious chair, I'm not going to say, well, go back to the minutes and read it. I'm not going to say that. But the conversation, because I really don't want to plow back. We spent literally like 5-6 minutes on this, a little longer than necessary, but it provided clarity. But I will say the spirit of what is being said is, although we have folks from unions and other community groups as a part of our our legislative committee, right? They are not voting members. Okay, only board members are voting members of this committee.
Yep, that was my only question. Thank you.
Hard stop. Yeah. As Phil would say, hard stop. All right. I don't see any other questions on this. All right, so I am in agreement that we do hold it for one more month just to have more dialogue. It seems that, like, one thing I don't want to do is put something up for voting by our members, and we spend 2 hours in dialogue on something that we could have had dialogue in our committee. So I'm probably most comfortable in not moving this forward for this particular month. I think we should hold it and get as much conversation and dialogue and clarity as possible, and then put it up when we have general consensus from our board members that this is something that we're comfortable moving forward. Thank you, Dr. Silva. I guess in the spirit of that, can we please send this to every board member and ask for feedback in the next 3 weeks or the next 2 weeks, so we can be prepared when we come back to this policy meeting with comments to make the adjustments that we need to make. And, we're not spinning tires in a public setting trying to get this together. Because the intent and the idea is definitely respected, and we are moving forward respectfully. But I don't want to tear it up just on a few words in a policy. It's not worth that.
Yes, sir. We will distribute this with our policy minutes and board materials And certainly, maybe Christina, can we send a separate email to board members asking them to review and send for questions forward to the policy committee?
Yes, that makes sense.
Yeah, and if we could put a time frame on it, that gives folks, gives folks an idea of when we want it. Because again, we want to do this right, and we want to make sure the input is there. So that gives us time to review, gives you time to make the edits and the mark, do what we need to do on that end.
Thank you for that.
Okay, what's our next agenda item?
Our next item on the agenda is our health services policy. It's policy 5141 with its former number was 5151.
Okay. Now remind me, was this a recodification or are there any amendments or what is this?
There are significant updates and revisions and refinements to this policy. So I'm just finding it among my tabs here.
Yep, take your time. It's good to see Francois, our board member Francois Ledger on, and board member Brody on as well. Thank you all for coming on.
Good morning, everyone.
Good morning.
Here we go. Thank you for your patience. So there were significant changes and updates to this policy. If I may just leap right into this. And we did have contribution as well from our district medical advisor, Dr. McGilpin, and also from Deb Comedes, who leads our health and nurses for the district. So there were significant changes. This is adopted from the CABE model policy, but there were refinements on top of the CABE model policy in order to ensure that that our policy was up to date and would meet the needs of our students. So you can see the red text is the text that has been added. And it speaks to health records and regular health assessments. While appearing in the CABE model policy, a registered nurse, Dr. McGilpin checked the health procedures maintained by the state of Connecticut and indicated that it's in fact not a registered nurse. So we did remove that for regular health assessments. An advanced practice registered nurse is acceptable, but just a regular registered nurse is not. And then what the health assessment includes. Again, a physical exam, immunizations, updated vision, hearing, postural, dental screenings, potentially testing for tuberculosis, sickle cell anemia, or Cooley's anemia, and other regular medical tests that are conducted to keep students healthy. I'm sorry, Mr. Walker, I just saw your hand.
Apologies. No, I'll wait till you're done. Sorry.
Okay, thank you.
Yeah.
So under regular student health assessments, other information, including a health history that the physician believes may be necessary. And then we have requirements for students in grades 6 or 7 and in grades 9 or 10. Those are mandated checkpoints for health and well-being for students in those age groups. And so the need for that physical exam at those times, again, all part of the CABE model policy. Having a representative to receive reports of health assessments and immunizations from healthcare providers, and we do have that process in place through the work that Deb Committees and Dr. McGill-Pandu do. And they need to be authorized. I'm going kind of quickly, but I know everyone received a copy of this redlined policy in their email previously. Everyone on the committee has received it. So also the conducting of vision screening, hearing screening, postural screening, tests for tuberculosis. And immunizations and vaccinations. We did have a question about whether or not a student would be allowed to enroll in the district schools without vaccination and immunization. And all these additional items are actually covered under the requirements from the Connecticut Department of Public Health. So we did not need to specify what those requirements were because we are following those guidelines. And if they change, we don't have to come back and revise our policy in order to follow the guidelines from the Connecticut Department of Public Health. So that is why the model policy language has been scratched in order to just set our authority at the Connecticut Department of Public Health. So we have that flexibility to respond to changes should something happen, an outbreak or something that the Connecticut Department of Public Health issues new guidance for, we'll be able to follow it right away. So students shall be exempt from the appropriate provisions of this policy when so there are some instances where vaccinations and immunizations might be contraindicated due to health challenges of the young person. And they may not be able to actually be vaccinated. For example, if a student is recovering from cancer and receiving chemotherapy, certain vaccinations would not be recommended, or certain immunizations. So we don't want to expose the young person to anything that would harm them, given a fragile medical state. And there was also change in the law around religious objection to the administration of vaccines and immunizations. And what the school district is allowed to do is to require to mandate vaccination and immunization. When there are grounds for religious exemption, there are stipulations that the student needed to be enrolled in preschool or pre-kindergarten before April 28th, 2021, when the law changed. And that there's more language about those religious exemptions here. There's also the situation where a child may not have physical documentation of their healthcare status, their immunization and vaccination status. Potentially imagine a refugee student who comes from a war-torn country who left and is finding refuge in our beautiful city and doesn't have all their documentation. So we do have ways to work through that in alignment with McKinney-Vento and other provisions. And this policy does address that as well. Again, many, many changes. Health assessments, interscholastic sports programs. There are revisions here where it is every 13 months, not every 2 years, which would be 24 months. So that was updated. And that arises in part because kids are growing so fast. There has been instances where a heart condition has not been discovered in other districts, not in Hartford. And so a checkup every 13 months ensures that we have a more regular review of rapid growth happening with young people and their wellness in response to that growth. So that's one of the reasons why this policy has, instead of 2 years, every 13 months, so a shorter time frame. And the end of this policy speaks to certainly school personnel responding to the immediate care necessary for a student's illness or sickness that happens on school premises, but also that we would maintain files on emergency information cards for each student, which we do. And those of you that have children in the district know how vigilant we are about completing that information. The legislative references are also updated as well. Legal references. So this would be a big revision because November 17th, 2015 was the last time this policy was visited by our policy committee. And that concludes my overview of the policy.
Absolutely. Thank you so much, Dr. Silver. Board Member Walker, I think your hand was raised.
Yeah, thank you, Chair. Dr. Silver, I was waiting for you to finish because my question is more about just understanding the policy as written. So it appears that many of these sections are just brand new sections added to our policy to comply with CABE. It seemed like when I look at the policy, there was the health assessment section and then kind of school-based medical services. But then there seemed to be a second section of health assessments and then services offered at schools. Is there some reason why it was separated twice, or just maybe my copy, it just came across like that? If you scroll towards the bottom, it seems like that health assessment and then school-based, like that's the student medical care. Just keep scrolling. Maybe just keep rolling. No, keep going. Maybe it didn't happen. That's more assessments, keep going. Okay. Yeah, so that was just in my copy again. Yeah, and yours, it got consolidated. Okay, so there's just the one section. Okay, it's just the way, again, when I pulled it up, the way the markups happened in the copy I was looking at. So the only question I didn't have is there, you said there's higher frequency. Is there any, like the cost factor, I guess parents can get support, I guess, from the state or local to do this additional work. The other question I'd have, part two of that, is these services for school-based medical care, are they going to be at each of the middle or high schools, or is there anticipated to be maybe more of a centralized place that students will be referred if they need? I mean, because some of the screenings seem kind of specific and whatnot, so I didn't know if each high school, middle school is going to have that level of medical service.
Thank you so much for that question, those questions, Mr. Walker. So your first question is about the cost of the services, right? And how the family is accommodated if they don't have the means. And the other question was about health clinics, school-based health clinics. Okay.
Correct.
And, oh, I'm sorry.
Yes, correct.
Okay. All right, great. So the cost of services, there is language in this policy that if the family, let me see. Let's see. I know that it was related to the word town when I was reading the policy earlier. Okay, I will have to look into that because I believe that it is covered at some point in the policy, but I'm not finding it right now. Let's see.
Yeah, that's okay, because I think what generally the questions that you mentioned about the 13-month thing, and I didn't see that that was more frequent than the past. So that kind of generated the question. So yeah, you can give me that answer outside the meeting.
Good morning, Dr. Silver. Would you like me to jump in on that for a moment?
Oh, yes. Thank you so much, Ms. Comides. I didn't see you here. Welcome.
Good morning, everybody. So just to speak to the sports physicals, so what we've been doing is where there's a need for sports physicals, Dr. McGilpin has actually, our medical director, has actually been going to schools to, we sort of batch the physicals. We have the parents sign the consent form, and then he'll go to a school. Most recently, he was at McDonough on Friday, and I think he did 10 or 15 sports physicals. So that's how we've been handling that. The coaches communicate with the nurses, who then communicate with me or Heidi Schmidt, our athletic director, and he'll actually travel to the school and get them done. So it's been working pretty efficiently in that way for the sports physicals.
Okay, yeah, all right. That's a good example. I see what you're pointing to.
Thank you so much, Ms. Comides. And Ms. Comides, the other question that Mr. Walker had, which maybe you can help us with, is the cost of healthcare services.
Sure, thank you. It's a great question. So when Dr. McGilpin goes and does physicals, there's no cost to the parent. And our school-based health centers are also available to do regular physicals and sports physicals at no cost to the parent.
Deb, I can't see your last name.
Oh, Comides, hi.
Oh, Comides, hi. So I guess if I can have the quick follow-up, then can you confirm that these school-based health clinics, are they going to be at all the middle and high schools? Is that the idea of where these clinics will be?
No, so we have fixed medical clinics at and I'm looking at the list right now at some of our high schools, but so we make appointments for parents to either bring their children to our fixed locations, or Dr. McGilpin will go out to really any school to do the physical nurses suite at that particular school. Does that answer?
Yeah, that answers my question. That's what I was trying to figure. So students then get referred to these centralized locations, and then they set up an appointment and go. Okay.
Yes, exactly.
Okay.
Okay, Mr. Walker, if you're satisfied, thank you so much. And thank you, Ms. Comides. Ms. Brody has her hand up.
Okay, I didn't see Ms. Brody's hand. Sorry about that. Go ahead, Ms. Brody.
Thank you. Will this policy cover anything in regards to our record keeping as far as the activity in our health centers?
I'm going to defer to Ms. Comides again for our record keeping information.
So I don't believe that this policy addresses record keeping at our school-based health centers. I believe that the language, and it's at the top of the policy, is speaking to student health records, school health records, which are covered under FERPA. And I believe that that's what this policy is speaking to.
Little worried about our record keeping. I know in the past there was a organization that is focused on health in the city of Hartford, and at that particular time they were focused on youth health. So I'm wondering, if it's not going to be covered in this policy, because they need to know certain information. If they're helping our community, of course they need to know not anything covered under FERPA, but just our data, like how many students came, to the health center, and however it doesn't violate FERPA to help that record keeping. Because if these entities are servicing our residents, they need to know your data to better service and know what to focus on and what to bring light to. So I'm wondering, how are we going to deal with that piece if it's not going to be identified in this policy in regards to our record keeping outside of FERPA?
I think I understand your question, Ms. Browdy. So our school-based health centers are operated and maintained by Board of Ed, excuse me, employees. It's not an outside agency that runs them. We sort of run them in-house. And we are governed by, they're licensed outpatient health clinics. So those are governed by FERPA, just like any health clinic would be. Does that answer?
No, it doesn't. So in our health centers, students come for various reasons. Do we track that?
Yes.
Okay. When outside agencies that service our community request data, there is not a smooth interaction. So how can we make that better in regards to our record keeping and what's available to the public on request regarding the health centers, if it's not going to be covered under this policy?
I'm not, it's a great question. I'm not sure if that in particular is covered under another policy. I could tell you that our data is reported to the Department of Public Health, but in terms of reporting it to other agencies, I'm not sure if that's would be covered under another policy or not. Dr. Silver, maybe you know.
And Dr. Silver, can I bring more clarity? It could be okay, if STDs, they were at a high, right, for our teams. If an organization is dealing with awareness in the community around STDs, providing that community outreach engagement, and they need to know from us certain information, how do we work with them so they can service what we're seeing spike in our at our health centers? So where does that land if it doesn't land here in regards to data, the data piece? And it might not be a conversation for at this moment, but it's a very important one that I don't know where it goes, but I was saying, since we're discussing policy as it relates to this subject, how do we deal with that record keeping, which is crucial?
Yeah.
And I'm saying records that are to be made available to the public, nothing that's private, stuff they should be able to call us up and ask for because they're helping our teams in the community.
Yeah, I think you raise a good point with that. And I'm not sure if Deb or Dr. Silver has an immediate answer to that, but it certainly is something that that we certainly need to look into. Deb, is that something that we can come back to, or you give us some information that we can really look over regarding that? Because she does make a very good point.
Yeah, I agree. It is a very good point. Thank you. And I would be happy to do a little bit of research into that and see if that's covered somewhere else or where it would be best addressed and how. Okay. Absolutely.
Could we put a time frame on that so it's just not like in the wind going months and months? A check-in at least within a month to know next steps or whatever. So I can track it appropriately.
Yeah, certainly. We certainly want to make sure you get the information, Mrs. Brody, because I don't know about other committees, but certainly I want to make sure board members' times are respected and their questions are respected and lifted appropriately. So Deb, is there a certain how much time do you need to just review that and just get some preliminary information?
I think a month is a great time frame. If that works for this committee, that would certainly work for me.
Okay. So you thinking by our meeting in June?
Yes, that sounds great if that works for the committee, yes.
Dr. Silver, with this particular item, is this, please remind me, first reading or second reading?
This is a first reading.
Okay, so that's appropriate. That sounds appropriate to me. How about other board members? Does that sound appropriate and enough time to get information back and make an intelligent decision on this?
Yes, my feedback is let's take the time, I think, and get this answered completely.
Okay, very good. Thank you, Ms. Brody, for your thumbs up. All right, any other questions regarding this piece of policy here?
I do want to just speak to Ms. Brody's question a little bit as well. We have many partners, and we do, when there is a request for information, we certainly do work with our partners. I know Chief Blackburk does a lot of work with our community partners. And so I would like to consult with Chief Blackburk as well about how she might be engaged in supporting this work with other partners in the community.
I appreciate that. This particular one, it just was like pulling teeth. So hopefully we can, make it much smoother. I appreciate that though.
Thank you, Ms. Brody. And with regard to STDs, I believe that there is a mandatory reporting to the Department of Public Health. Deb, can you clarify that?
Yes, there is mandatory reporting to the Department of Public Health. You're correct.
Thank you. Okay, so Reverend Johnson, we could move forward for a first reading for this policy at our next board meeting and follow up that first reading with additional information in our next policy committee meeting in June around the record keeping and sharing of data, collaborative support of partners in our community with regard to the health and well-being and communicating the health and well-being summary statistics to different partners, if that is what the committee so wishes.
Yes. I have no issue with that. That sounds about right. And I don't see any opposition to that at the moment or hear any opposition. So yes, let's move forward.
Okay, thank you. So we have done our second reading for student attire, for school governance, for our 4 recodifications, and our legislative program. We are pausing on the legislative program to socialize it with our Board of Education in further detail.
Let's not call it program. Let's call it.
Oh, I'm so sorry, committee, legislative committee. Thank you so much for that.
No problem. No problem. Because you're about to open up another can of worms.
And we have a first reading for health services that will go forward to our board. We had some topics for discussion, but I don't know that we have any updates on those. So if there are no updates, and I would defer to Christina for any updates on those items. If there are no updates, I turn this back over to you.
All right, appreciate it. All right, so there's one more thing that I do want to bring up that since I see that is Deb still here?
No.
Deb left?
Yes, she did.
All right, well, I hate to talk about her when she's not here, but I do want to talk about it. So there's one thing I want to put on our radar so we don't, or at least put on our agenda, and it could be, it doesn't have to be top 5 on our agenda, but if it's top 10, it would be good. But in terms of policy and how coaches are brought in and the ADs are brought in, this weekend, I just, was reminded of what happened when it came to to Hartford High in that whole situation regarding players and paperwork, so forth and so on. And so I'm not sure if this falls in the purview of the policy committee. I think it does, but I just want to make sure that our AD at central office has the proper policy in place. So when she onboards coaches, that coaches are aware of how to transfer students, so we don't run into what we run into in the high, in the high season of our sports programs. Again, I'm not sure if that falls under the purview of this particular committee. And I'm, willing to hear otherwise, but I think my overall sense is that I want to make sure that we set our students up for success if they're being transferred over to play academically, and that they have clarity of what's going on. And I don't want to happen what happened last season, this season. So I'm not sure if we put forth policy as it pertains to our athletic directors and how they're being managed, so forth and so on. But that's something that did come back around for me in my mind of areas where we could do better, so we're not running into those small instances with parents and their students in the middle of a season, right? And I think some of the error might have been on our end, just as a district, and I want to clean that up. So again, I'm not sure if this is something that falls under this purview of this committee, but I do want to raise it. And if it needs to be booted to another committee, then let's boot it over there. And
I want to chime in, Pastor AJ. I don't know all the fact patterns here, but this is probably the right committee to maybe discuss it in, because there may be like the issue of what up today where it's either a policy or kind of a management practice. And one of the things that I would like to find out, based on what you're talking about, where does this fall? Is it something that's covered by management practices or policy? And maybe our district people can help us understand, where the correction needs to be done.
Yeah, appreciate. So again, we don't have to have that dialogue at this particular moment, because I want to get folks off the phone and back to work and so forth. But I do want to raise that. And that conversation can happen offline. Go ahead, Christine.
No, I was gonna say, in case you can't see, Ms. Daristo Ledger has her hand raised.
Oh, I couldn't see it. I'm sorry. Go ahead, board member Francois.
Thank you so much, and good morning, everyone. I just have a question, and I'm not sure if this would be the committee that it would be, on or addressed, but there's something that was brought to my attention, was with regards to Montessori, which I'm a very, big advocate for. So with the Erdkinder, the older children, they go to a farm, a different location. So when they go to this different location it's part of their curriculum, it's part of teaching, it's part of their learning as well. It's classified as a field trip. It's under that category, but it's not a field trip. It's part of their curriculum. So I'm trying to see how we can get that changed to adding that as part of their curriculum. So I don't know if there needs to be a policy, because when you have something that's part of the curriculum that's categorized as a field trip, then if there's, funding that's affected by field trips, and they decide that they want to cut field trips, then that's cutting into their curriculum. So I'm putting that out there because I'm looking for, guidance as to which committee that would fall under and how we could fix this.
Okay, so we can add that under just some follow-up that Christina and Dr. Silver can do it. I'm thinking that maybe falls under teaching and learning, but don't listen to me on that. That's just my overall, perception, but I'd rather come into the conversation with some facts. Yes, Christina, final comment, and we're getting out of here. Yeah.
Yeah, I just wanted to say that let's talk after so I could get clarity on what you were talking about with the ADs and the coaches, so I can fully understand, and then we'll do our research.
Certainly, certainly. Well, listen, thank you all so much for your time this morning. This was very productive, and I appreciate all my board members for showing up. Okay, definitely appreciate it. We do start at 8:30, just for those who may have forgotten, but I understand everybody has busy mornings. But I certainly appreciate participation this morning. Thank you, Attorney Mazurek. Thank you, Dr. Silver. Thank you, Christina. And thank you, Deb, for coming in, and Ms. Hill for coming in and being a part of this meeting. You all have an awesome and fantastic day, and we'll see you.